All right, good afternoon. We're going to go ahead and get started. I want to make sure we're being very sensitive to everybody's time. Thank you for joining us today for the first of our regular community conversations at the Office of Rural Health. As we have the last couple of years in January, we like to focus on what's going on down in Salem and what's happening in Washington, D.C. And kind of help people stay informed. So thank you for being here. Couple of things as we get started. I think Sarah just put in the comments or the chat section. If you have questions or comments as we go along today, please stick them in the chat. We are going to try to address some of those as we go along, and we'll have time at the end as well to answer questions, because this wouldn't be a community conversation without conversations and questions and answers. So really appreciate you all doing that. And during the presentation yourself, if you could make sure you're all on mute. Want to really quickly put out there for you the schedule for 2025. As you can see, our first one is today. We have them scheduled going throughout the year in March, May, July, September, and November. And you can see the topics that are on there as well. You can check on the schedule regularly. It's on our website under events. And you need to register for each so you can get all the information. So registration for today's does not get you registered for all of those in the coming years. So please check that out. If you got questions on what those topics are, please reach out. We'll be happy to discuss it and make sure that we're covering some of the topics that are really important to you all. Real quick for today's agenda, we want to do a little bit of an overview of the Oregon legislature, what's going on down there, kind of look at some of the dates that are coming up and what's important for those deadlines as we go through the session, how to track legislation, the bills that are important to you, if you just got questions on where things are at, if you want to testify for something in support or opposition, how do you do that? We want to chat a little bit about some key bills affecting rural health, and I'd say more their key concepts that are going to affect rural health. Going to spend just a little bit of time on what's going on in Washington, D.C. With the new Congress and the new administration and how that's going to impact rural here in Oregon, and then open it up to your thoughts and questions. So that's kind of what we want to go through today. And again, we'll try to make sure we're being very aware of everybody's time, because we know you're doing this over your lunch hour, and we really appreciate you joining us. I am very excited to introduce our guest today. Senator Deb Patterson is the chair for the Senate Health Committee, and she has been the chair for the last couple of sessions and has considerable experience on what's happening in Salem. I'm going to stop sharing here for a minute so we can get back to the screen and be able to see Senator Patterson a little bit more clearly. There she is. And Senator, really appreciate you being here with us today. And we're hoping you could give us a little bit of a rundown of how you see this legislative session going when it's dealing with healthcare in general and healthcare issues that might be more specific to rural Oregon.
Well, thank you so much. And it's really a pleasure to be back with you. I realize I have to update that picture you have. That was like before I had the gavel for this committee. So I've aged significantly in the last few sessions. Anyway, nice to see you all today. And thanks for working on these issues together with us in the legislature. I can't underscore enough how important it is that your voices are heard. So please do sign up to testify on bills. Remembering that you can testify remotely. As long as you sign up on OLIS, the Oregon Legislative Information System, you can testify on anything on any of our public hearings. Just sign up at least 30 minutes before and you'll be included. Of course, we're always glad to see you in person too. Again, same thing, sign up 30 minutes before on OLIS, and we will welcome you to testify on anything that we're hearing. A note about our current Senate Healthcare Committee. I'm honored to continue as chair of that committee, and I'm pleased that Vice Chair Cedric Hayden is continuing on into the committee as well. He represents rural Lane County, and his experience as a practicing dentist in rural communities has been extremely valuable. He brings a strong interest in health equity, especially related to access to care, network adequacy, and access to care for people with developmental disabilities and those who are dually eligible. eligible. Senator Diane Linthicum has joined the committee. She also represents a rural area, South Central Oregon, around Klamath Falls. We have Lisa Reynolds, who's a pediatrician. She is from the Portland area, but her expertise as a pediatrician will bring a lot to our committee. We know that access to maternal and child health services is less available in rural communities. Very concerned about that. She has a omnibus bill that I hope you'll take a look at. That we will be hearing in the committee that she chairs, which is early childhood and behavioral health. But I'm a co-sponsor of that, really anxious to support that work. I would urge you to take a look at that. And also we're joined again this session by Senator Winsby Campos, who is our link to the Ways and Means Committee. She chairs the Health and Human Services Subcommittee of Ways and Means. So each member of our committee has a very important role to play and will be very instrumental in moving the conversation forward. Related to some of the challenges that we're looking at in Senate healthcare this year, and then I'm going to connect to the larger picture. One is related to hospital discharge challenges, particularly during the pandemic. We saw folks were waiting for discharge. There was no place for them to go. Still, long-term care facilities are understaffed, and it's hard to find spots to move quickly, which impacts then hospital discharges. Hospitals are holding folks on, and including in rural areas, holding folks in the hospital waiting for long-term care beds. That's a cost to the rural hospitals in particularly, which are very strapped right now. It's not hard to. We want to keep every one of our hospitals open. I'm committed to that. So please know that I stand with you on that. But this was one of our efforts to try to take a little financial pressure off of hospitals and to get people into the right places at the right time. So we had a group of legislators and representatives from hospitals, long-term care, patient advocates, and others who worked 4 hours a month for the last whole year. We put in close to 50 hours of effort into drafting legislation that will try to address some of those issues. That will be introduced as Senate Bill, or it has been introduced as Senate Bill 296, and I hope you'll take a look at that and give that some consideration. Also, healthcare workforce, which is currently a placeholder bill, but is being introduced as Senate Bill 27, is an effort. We know that in the next the study was done in 2023 by the Oregon Oregon Employment Department, that in the next 10 years from then, which is only 8 years from now, there would be a need for 240,000 workers in healthcare and human services, the largest need of any sector in our economy. And those shortages would be, of course, across the state. The Senate Bill 27 would put in place training partnerships to help folks who are already perhaps in entry-level positions, such as home care workers or clerks, work with community colleges and employers and four-year institutions to move up to CNAs, LPNs, RNs. We must address that need. One of the recommendations also of the Hospital Discharge Challenge Task Force was some strategies to try to help address the issue of needing more nursing faculty, which plays into this. Thankfully, we passed a bill a couple years ago, which allows community colleges to offer a 4-year BSN program. The problem that my Freudian slip alluded to was that when registered nurses, and I'm going to ask somebody else to watch the chat because I have on the glasses that I can't see the chat, so someone's going to have to read those questions. The problem is that newly minted RNs, according to the Oregon Nursing Association, 30% of them leave the profession, not just leave their job to become a traveling nurse, but leave the profession within the first year, 30%, and another 20% the following year. So new nurses, we've lost half of them in the first 2 years. We need to find a way to retain our healthcare workforce. And so one of the strategies is recruiting from people who are already working in healthcare and want to be in healthcare and help them move up by helping by paying for school rather than reimbursing, and by having other strategies for that. So I can talk for a long time about that, but that's kind of the gist of that. In partnership with that, we're working with the Oregon Medical Board to bring a bill to provide additional funding for the wellness program that is offered to healthcare professionals across the state. Senate Bill 531 is what that's being introduced as, and it will it offers the opportunity for mental health support in a private setting unrelated to where one is working. So one doesn't have to reach out to their own employer benefit where they might feel like, oh, this might get back to my supervisor or something. Privacy of really reaching out to that wellness center that will serve all healthcare providers. We also have a bill working on expanding the number of regional health equity coalitions. Currently, it won't yet reach every region of the state, but that is the goal. So it will get closer to that. And it's not the last step. It's another step in the road, but not the end of the road. And we have a bill that's still in conversation, but I hope it'll be ready before the deadline here, around helping pharmacists to understand current statute of what they are able to do as they operate at the top of their scope of practice to be able to assist patients who come in with health concerns. Currently, they're allowed to test and treat for COVID. That has been extended, as you know. They are allowed to offer PEP and PrEP related to HIV and contraceptives, of course, but that conversation continues. Also, the corporate practice of medicine bill, which you're aware of, and it's affected some rural areas which have doctors who have non-compete clauses, whose practices have been bought by private equity firms. That is a bill that was in the House last time, with strong bipartisan support there, came to the Senate and was sent to rules, died before sine die, is coming back and is starting in the Senate, so we'll have time to hear on that. So I'm going to stop for now, and I think there might be some questions. And so, and if you, about the one thing that was in my email about what's happening in DC, wow, wild ride. We're going to wait and see, but certainly we're going to business as usual, unless we have to change business in order to make sure we serve every Oregonian. We want to make sure people have access to care. So we need to grow the workforce. We need to make sure that we keep our institutions open and operating and support our hardworking workforce. We also just heard yesterday, our first bill that we heard this session in Senate Healthcare was related to public health. We've got to support public health, especially given what's happened at the federal level. We don't know now that we're not members of the World Health Organization anymore. Yeah, it's an interesting time. Anyway, I'm going to stop there and see if there are any questions. And I know you have other things on your agenda. Sorry, I talked fast, but a lot happening right now.
Senator, thank you. Yes, there is so much going on, and you know, we have our Oregon direction, and we just are waiting to find out what the DC direction will be and how that impacts. There was a question, and I'm not sure if you know the answer to this one, but will the session be addressing the need to continue fully funding or increasing funding to the How To Grant program to innovate healthcare workforce? I'm not sure if you're familiar with that.
I'm not familiar with that, but I'm certainly happy to look into that. And can I email you back and you could get that out to
Yeah, absolutely. Absolutely. And I think just on the funding mechanism of that, part of that comes from matched Medicaid dollars. And so I think Patch asked that question, and we'll do some research into that to figure that piece out and get that answer out as well.
Thank you.
So you did talk about the workforce pieces. There are several bills up today on the House side on the tax credit. There was the bill that you all heard, I believe it was Senate Bill 161 for public health, which would give additional support for those that are wanting to train in public health. Do you see the legislature, there are going to be a lot of demands on funds this time with an uncertain budget. Does the legislature seem to have a guiding principle when it comes to our workforce support and how those bills will be funded?
I think I'm going to answer the middle part of that question first. I think this time around, we're going to have to be so cautious about whether or not we need to protect dollars in more of a rainy day fund, in case we don't know what funding might be stopped from the federal government that we depend on here in Oregon. And so I think we're working closely with our sub chairs in Ways and Means to kind of sort of wait and see how much money we're going to have, and the revenue forecast always tells us a lot, but what we don't usually have to take into account is also what might happen at the federal level about stopping funding sources that we've counted on traditionally and for many years. So this is a very different budgeting process. Obviously workforce is a top issue, and supporting workforce and growing the workforce, we have to. I mean, it's the largest, almost 250,000 people we need to replace, and 80% of those from retirement. So it's not a matter of not needing it, and it's not a matter of not it's imperative that we do this, and yet we don't know the number of the dollars that we will have available. Very tough situation right now.
Yeah, absolutely. So we got a question in that talks about hospitals directly make up a large percentage of the healthcare workforce. And there are other partners like public health that are also impacted by the nursing and healthcare work shortages. Are there going to be opportunities to support non-clinical healthcare as well? So trying to focus on how we support the out-of-hospital healthcare providers.
Absolutely. And given my decade as the director of the International Faith Community Nursing Association, doing community health nursing out in the communities around the world, really, I have a real heart for the preventative type of work, and the navigation and the resource referral and the connection, and that can be done elsewhere. And I'm all about prevention. So yeah, I mean, obviously the squeaky wheel gets the wheel. Squeaky wheel, right? Squeaky wheel gets the grease, and since we only invest 3% of our money into public health nationally, and I don't know if that's even going to go down, we have to be sure with it that we keep that front and center. So who has lobbyists here in the Capitol? The Hospital Association, the Oregon OCA, the long-term care folks, and not that they're not doing good work. We need hospitals, we need long-term care facilities. That's why you need to show up, and you need to testify for the work that you're representing, and so that we can hear your voices too, because it's needed.
Excellent, thank you. So,
sorry, that's not really much of an answer, but that's the reality.
Yeah, absolutely, absolutely, and I appreciate that answer. Lindsay Miller out in the Gorge, has made a comment about have a promising pilot during using community health workers in the Gorge to improve primary care for older adults, and they play and should play a role in improving care and access, and being a part of the workforce. Our office has worked with the Health Authority and CLO, the Coalition for Local Health Officials, in a lot of support for community health workers in the last couple of years. Are there community health workers included in the bills that you're seeing? And I believe there is in Senate Bill 161, and a focus on trying to figure out how we can get community health workers better reimbursed?
Oh, absolutely. I think that everybody should be operating at the top of their scope of practice, and that includes community health workers. That needs to be a recognition. Sorry, my first meeting started at 7 this morning, so
No worries.
I'm paid a little bit. A recognition of the amazing work that community health workers can do, the training support for them. And as you said, the reimbursement for this work, it is work. It's not just a nice person showing up to do nice things to help their neighbor, which is nice, but that's not what this is. And so absolutely, please be in touch with me so that I know how I can help you. But I am in support of bills such as Senate Bill 161, which is at some risk because of the fact that it's relatively new as a profession, right? And so some of the organizations have less of a long period of track record. And so we need you to speak up for those programs. really, really need you to do that.
Excellent. Janessa from the Coalition of Local Health Officials says House Bill 2216 is all about community health worker billing. So hopefully that will be coming
Thank you.
through.
Yeah, I forgot to mention all the good stuff they're doing in the House, and it's a lot. I think they have like 121 bills. I think we only have like 64. They're doing related to PBM reform, CCO work. Yeah, there's a lot.
Absolutely. The issue of Medicaid, potential changes in Medicaid, which will impact many people and a lot of what we do in Oregon. There was a bit of a shutdown on our access to dollars the other day. There is a lot of conversation about whether Medicaid funding might be coming down in the form of a block grant in 2026, et cetera. I know you made the comment that you're operating as business as usual till you know more. Can you talk a little bit about what kind of contingency plans or conversations might be going on with uncertainty about what's going on in the at the federal level?
You know, I think part of the contingency plan is just being very cautious about how we spend our dollars right now, and also being really intentional about communication within our caucus, with our colleagues across the aisle, and with everyone. I mean, trying to nobody's hiding anything. We just don't know anything right now, and but we're committed to protecting the health and well-being of everyone in Oregon. So.
Good. Excellent. And I know you've got to go here shortly. One quick last question comes in from Patty Barfield, part of the nursing workforce challenge, and I would say for a number of our clinical workforce is finding clinical preceptors. Washington State funded a nurse preceptor grant program. Is there any discussion in Oregon legislature around doing such a thing this session?
I love that idea, and I don't know if that's in the House. I know one of the things that the hospital discharge challenge task force is doing is looking at studies to find strategies. So if you could send me that, I would really be very grateful. One of the other barriers is that currently, if you're a nurse in a hospital, for example, you can't serve as nursing faculty. And also there is a cost to being a preceptor, a cost to the person doing that and to the institution. And so this grant would be really helpful, but sometimes institutions are reluctant to have either nursing or even medical residencies, which is really kind of worrisome when we need so many more doctors. People are having such trouble finding access to care, especially if they move here and trying to get a new doctor or if they're on Medicare.
Yeah, absolutely. Absolutely. Well, Senator, I appreciate your time being here and your words of where things are going to go. Any last thoughts before you head on to your next meeting?
Just thank you for what you do, both in taking care of people with health conditions and encouraging people to do all we can to stay as healthy as we can. We always have much work to do and more than can be done, but doing it together is really a privilege. And I'm grateful for the chance to talk with you today. Please come see us. It's lonely here sometimes, so we'd love to see you anytime.
Excellent. Senator, thank you very much for your time. We appreciate it. We'll be in touch. I'll be down this afternoon to testify and on some bills, and we'll be there seeing you a lot. So thanks again. I really appreciate it.
Thank you. Have a good day, everyone.
Lindsay, yeah, I'll talk a little bit about how to access all of that stuff here in 1 second. I'm going to share my screen again so we can get back on the slides. If I can do it the right way. Let's see. As my staff will tell you, I'm not very good with technology. So, all right. So we got to hear from Senator Patterson, and we will, let's see, where do I go now? There we go. All right. So what else is going on in the legislature? I would just say very quickly that, and the senator mentioned this as well, you know, you can testify virtually now. One of the positives that came out of COVID when it comes to policy in the legislature is the whole system is set up to either do it in person or virtually. If you haven't been down to the Capitol building for a while, the last few years it's been under construction because they are earthquaking earthquake proofing it. And before it's done, if you get a chance to get down there, it is absolutely amazing to see how they do that with that building. But it's still under a bit of construction as well. So just wanted to do some, and Sarah's going to let me know if there's questions, immediate ones, or we'll try to hold them to the end because I can't see the chat at this point. But just a quick structure to remind you all of how the Senate and the House is put together and how they work. So this talks about what their political leadership is, with a majority and a minority leader in the House, with a speaker, and then how that works through standing committees, interim committees. Most of what we will deal with all comes through standing committees that were created at the start of the session and will remain throughout. So that just gives you a quick organizational chart that you can see how the process moves. Another interesting point I thought folks might enjoy is that the House of Representatives has 60 members and each serve a 2-year term. And based on our 2020 census and the redistricting process that goes on every 10 years after the census is done, representatives represent about 70,000 people. And there are 30 state senators. They serve 4-year terms. And based on the 2020 census, they represent about 141,000. So gives you an idea of how many are in each of these members' districts. And the state house is up, everybody's up every 2 years. And in the Senate, it's just like at the US Senate, it is staggered. So not everybody is up every year. So all the key players. Governor Tina Kotek is still governor. This will be her last long session. She'll be around for one more short session. We assume that probably by the end of the year or so, we'll have a better idea whether she's going to run for re-election or not. But she will continue to drive a lot of the direction of what this session will do. As in the past sessions, homelessness and housing has been a big issue for her, and she'll continue to push that, as is the issue of not just economic development, but workforce issues and behavioral mental health. On the Senate side, Senator Rob Wagner is back again as the Senate president, but there are new leaders on both the Democrat and Republican side. So the majority leader is Senator Jama from Northeast Portland, and the minority leader, Senator Bonham, is from the Dalles area. I think he's just south of the Dalles is where he's from, but his district includes that area. On the House side, we have a new speaker. The previous speaker is now the new Attorney General for Oregon. Representative Fahey has been in the legislature for a number of sessions, but this will be her first time as speaker. So a little trial by fire as she goes in. And then Representative Ben Bowman is the House Majority Leader. This is his first year in that role. Previously, he headed the caucus campaign wing of things. So now he is the Majority Leader. Representative Christine Drazen is back. She left, and as you may remember, ran for governor during the last cycle. And then she came back and got back in the House and has taken back her role as Minority Leader. So of the three that are in leadership in the House, she is probably the most experienced. I would say for both the House and the Senate, there are such things called supermajorities. And when a party has a supermajority, they have enough votes that they don't need the other party in order to pass legislation. Due to the changeover of a couple of seats in both chambers, the Democrats do have a supermajority this year going into the legislative session. I think that in some sessions, particularly when they're flush with money, that creates a desire for whichever party that has that supermajority to really push for a lot of their programs. Excuse me. This time around, I think you'll see it to be more muted because, as Senator Patterson mentioned, there is just so much uncertainty when it comes to the budget. This is just how an idea becomes a law. It is a great cheat sheet to have. Reminds you that a bill gets introduced in either one of the chambers, and then it gets assigned to a committee. The committees deal with that. They either vote it out or they kill it in committee. They get it to the floor. They pass it to the other side, goes through the same process, and how it eventually gets to the governor's office if it does. So it is a great cheat sheet to if you've got questions or if you've got people in your office that are asking, how does that process work? I think this is a really good one. So a couple things about the session that we're in that to remember is we're in a long session. So during the odd number years, we go to 160 calendar days for our session. During short sessions, we're limited to 35 calendar days. And those days are determined mostly by how many floor sessions, when the floor sessions. So it could go longer than that, depending on when they call themselves into session. The long session is when we deal with the budget. We have a biennial budget, a 2-year budget. So it is this session that they will spend the extra time looking at the budgets and making determinations how much we will spend in appropriations and how much we will theoretically spend or not bring in when it comes to the tax credit budget. So we're giving out tax credits versus collecting that money. And in doing this, as they look at that budget, it's looking at how we do it for 2 years, how we make sure we don't run short of money in the end of the second year, and how much money do we have in a rainy day fund should challenges hit before we come back into session. Some important dates. Well, we've got through the first one, January 21st, the first day of session. So these are other really important dates that keep the process moving. February 25th is the last day for any member to introduce any new bills. And there will be a lot of bills this year. And like every other session, you get a lot of bills in. Some are never heard. Some are heard during the early parts of the session as informational and don't make it any farther. And then as we get to some of the latter times in April, though, we'll figure out which bills are going to actually live in which ones will die. Even if a bill doesn't make it out or very far out of a legislative committee, it is a long-term process for most legislation. So getting it before members and beginning those conversations and talking about what the issue is really important. So if you can get a hearing on your bill this year, you may not get it passed, but it makes you in a stronger position for next year when you can reintroduce that again and members have an understanding of what it is you're talking about. So there are 2 revenue forecasts. One's February 26th and one is May 14th. The 26th in February will give us a really good idea how to begin to look at our budget situation. May 14th is the final revenue forecast before the budget is set. We have a new state economist. So this will be his first time actually doing the forecast for Oregon, and they are using a different methodology this time than they have in the past. So many people think that the revenue forecast will come in a little bit more conservative than it has in the past couple of years. And if that's the case, probably won't have the big kickers that we've had from the last couple of years as well. April 9th, first chamber deadline, meaning that all bills introduced in the House have to be out of the House, and all the bills that were introduced in the Senate need to be out of the Senate and into the opposite chamber. If they haven't, then those bills will pretty much be dead for the remainder of this year. And then on May 23rd, it is the deadline to get them out of the second chamber. And so they're either going to pass clearly out of those second chambers or go into conference committee, or as often happens, they get sent back to rules committee, and those rules committees will stay open right until the end so that they can move some legislation if they need to. And then, of course, the last day of the session is set for June 29th, which is sine die. Now, a couple of you have asked about how to testify and how to track some of the bills, et cetera. So the OLS system is really a pretty impressive system. And if you just Google Oregon State Legislature, it'll come up, you can bookmark it. And this is the homepage that you're gonna get. And you'll see in the upper right hand, it gives you some videos about Capitol meetings, some news, some legislative dates, how to find bills, a little bit of instruction on how to use the site. Right there, sort of in the center left, it gives you the calendar for what's going on that day. And if you go across the top, you can get to all your Senate members, your House members. You can find bills that have been introduced so far this session and in previous sessions, as well as Oregon statute. The committees link will be really important for you. That's where you'll find the committees that you're looking for. Click on those committees, and then you will see the schedules in the right-hand corner. Click on those. You'll find out what bills are up. It'll show you how to follow along with video. So you can, at any time, if you can't make it into to Salem and you want to follow what a hearing is going on, you can do it right from your desktop. Again, it's really quite easy to remain involved in a way it was not pre-COVID. Also, when you go to those pages for the committees, you will see toward the bottom of the page how to sign up for testimony and how to submit testimony. So even if you don't want to testify, you can submit testimony on a piece of legislation. So again, making it very, very accessible for folks. Some hot topics for 2025. There are several. As we kind of alluded to a couple of times, there's the budget. We're starting off fairly strong. I mean, I think people feel fairly comfortable where we're going, but there is so much uncertainty right now. And that uncertainty is driven heavily by what's going on in DC. There is, and we'll talk about this when we get to the DC section of it, but there is a lot of conversation about the desire to cut budgets at the federal level. And that you can't do that and make substantial cuts anywhere without going after program. So when you hear the conversation about cutting budgets, that means cutting programs. There is not a lot of direction at this point as to what that means at the federal level and exactly what's going to happen. You may all have seen what happened this past week, and again, we'll talk about that in a second, that could have frozen a number of budgets for a lot of organizations and a lot of people. The Medicaid portal was down for a couple of days. So we're not talking about just a few small grants that the state might want to think about backfilling. We are talking about uncertainty about whether there will be funding for Medicaid and how much. We don't know if that means Medicaid will be a block granted, which changes how the money can be spent. We don't know how much money might be coming or available to FEMA. And as you've seen what's gone down in California with the huge fires, and then the conversations around how money will be reimbursed back to the states. We all know we're getting hotter and drier in the summer, so we know we could have a lot of fires again. This last year, we had to have a special session to replenish our dollars so we could pay our bills from the previous fires. So all of these things have a huge impact on everything that we're talking about. The fires and having enough money to pay for all that impacts healthcare because we only have so much money. The same goes with environmental programs, it goes with education, and then of course within the healthcare budget itself. So lots of uncertainty of where we're going there. Workforce. As the senator mentioned, there are a lot of bills out there that are looking at workforce. And when we talk about workforce, we talk about a much broader group of people than we used to. It is no longer just physicians, PAs, and NPs, although they're still very important. We are talking kind of across the board. We're talking about behavioral and mental health workers. We're talking about community health workers. And we're talking about, in a long overdue, in my opinion, really focusing on public health workforce as well. So really important understanding that those discussions have sort of across the workforce impact. Senate Bill 161 was talked about with the public health workforce legislation that was heard by the Senate committee. There are, I believe, 4 bills, maybe 5 this afternoon in House Ed that all deal with the provider tax credit. And that does a number of things from adding additional providers to increasing the tax credit amount. There are other pieces of legislation out there that are going to try to add loan repayment and loan forgiveness for additional mental health and behavioral health workers, and for psychologists and for other provider types. And so I don't have all the bill numbers on those yet, and they haven't all been, they're just now starting to be scheduled. So I think the important thing to remember on all of those is the discussions that the legislature will have in trying to figure out how to prioritize the demand on those dollars that will be available. On healthcare in general, outside of the workforce piece, there's a number of things. The senator has talked about, some of the corporate medicine piece and some of the restrictions that corporate medicine is putting on our ability to access care in rural. Many of you are very familiar with the 340B and the subsidy that comes with that supports a lot of the work our rural facilities do. Home health and hospice staffing is a huge issue. Hospital workplace safety, provider reimbursement, and that includes the community health worker payments. Maternal health is huge, as we all know, and access to the maternal health care is a big issue that's being talked about as well. And I highlighted in bold there the provider tax, because the provider tax is it is a tax on hospitals and insurance that allows the state to draw down federal dollars to help support our Medicaid program and access to care. So that is up for renewal, and there will be a lot of conversations in the legislature about that. That is another one that ties back to Washington as well, because we don't know whether the new Secretary of HHS and the new folks coming in there within CMS and how they'll feel about that as a program going forward as they have in the past. And then the last thing I put up here is EMS, because it's such an important piece. There is work with Senator Graber's office to move on the second legislative effort to modernize EMS. So there's going to be a move to offer some incentives for provider incentives on EMS for paramedics. And we're going to continue to try to get the support for that to be a little bit broader to increase our EMS workforce. And then the development and, more importantly, payment models that will support community paramedicine in our rural communities. Now I want to jump to DC real quick. This last week has been kind of busy. So let me start by saying whenever a new administration comes in, it's their administration, and it doesn't matter whether you're a D coming in after an R or an R coming after a D. Generally, what happens is all the secretaries and your higher level political appointees all resign, either prior or effective by noon on January 20th. And then at that point, the new president will generally appoint acting secretaries, acting directors, et cetera. This time around, there are a lot of those positions that have not been appointed in acting. So we have a number of positions within the federal government that have no directors or people technically in charge quite at the moment. But the secretary confirmation hearings are moving right along. There are 2 going on today. There were a couple yesterday. Several were approved last week. So those are kind of moving along right on schedule. They're usually done within a 3rd week, depending on whether there's controversy and somebody has to pull out and those types of things. There's also been a lot of every administration will come in wanting to look at the federal government and how they can focus it in sort of their view of where things need to go. And that is happening with this administration as well. And they have wanted to move really quickly. And so on the 21st of January, there was a memo that was put out. And each of the divisions have these. We follow the one under HHS, Health and Human Services, more directly. And remember that Health and Human Services, as an agency, oversees HRSA, which funds a lot of the work that we do, a lot of the grants that you all get, oversees NIH, the CDC, the FDA, and the USDA. So sorry, not the USA. Yes, USDA. So there are a lot of health-related components under HHS. So they put a pause on issuing new documents, guidance, and public communications on the 21st. And that kind of came without a lot of warning. And so right now, the agencies can't put out public guidance on anything. They can't talk about any, for example, for our office, we do a lot with HRSA. So HRSA can't talk to us about pretty much anything. So we've had meetings canceled on advisories to talk about the grants that we're applying for, new programs, or directional questions. They can talk to you one-on-one, but they can't talk to you in groups. The CDC has not been able to put out anything or updates on things that are going on or of concern. And this is going to hold until, right now, they say it's going to go until the end of February. So we don't know if that will be lifted sooner, but that's kind of where we're at the moment. And that impacts a lot of things. There will be a few of us from our office and a couple folks from Eastern Oregon going to the NRHA Policy Institute in a couple weeks in DC. No, normally there are a lot of meetings with where members of Congress and the administration come talk to. There's between 700 and 800 people at this meeting to talk about what's going on with rural health and what the program directions are. Nobody will be allowed to attend that meeting from the agencies or secretaries, et cetera. So there'll be a bit of a hole and uncertainty in that. We'll see what that means, hopefully in a couple weeks. A bigger one that came out on the 27th was a temporary pause in agency grant, loan, and other financial assistance. So that was really a freeze on delivering the money that a lot of programs are expecting. So that created such an uproar after a day and a half that they rescinded that. So once again, we are able to access the funds that we need for our programs and kind of continue to meet the obligations that we have under our grants at this point. So whether that will come back into place at some point, we don't know. One of the things that came out of the January 21st memo was a requirement for agencies to go in and review all of their programs. And there's a few things that they're looking for, and they're looking to figure out whether any of those programs have are interacting or doing or funding or anything with DEI, which is diversity, equity, and inclusion, and anything to deal with transgendered issues. Those are the two things that they're really looking at, and then they'll come back out with some guidance for programming after that. So we don't really know what that means. Going forward, we are going to continue to operate under the guidance that we have, which are under the grants that we have and under the programming requirements we have. And that's what we're recommending others do as well. And that they will be getting additional guidance to us out probably toward the end of February. So that's kind of what came out of this week, with things kind of going back a little bit to normal as we move into the first part of February. Couple things to keep in mind too that are really big and sort of the cloud over or the elephant in the room that is creating some challenges, if you will, for Congress, is that on the House side, there is no big spread in the numbers. The House is controlled by Republicans by only 3 votes. So when you have a caucus that is very broad and covers a lot of different kinds of districts, from suburban swing districts in the New England and parts of the South to really, really conservative districts in other parts of the country, it's hard for them to kind of come up with a plan. And you're seeing that kind of play out in the press on some very big issues because they can't afford to lose any votes. And so those big issues that they're looking at, one of the biggest are tax breaks. And then the other big one is immigration. And you're seeing all that stuff play out, but Congress is going to need to act on those. And they're going to do that, or they're going to try to do that through a budget process called reconciliation. And by using reconciliation, the House does not have to depend on any Democratic votes to get it out. But more importantly, when it gets to the Senate cannot filibuster that piece of legislation. So it only needs a simple majority in both chambers to get out. So they're trying to figure that piece out, but they have a tight time frame to do that in, and really need to have a plan together in the next couple weeks if they're going to meet all of the timelines that go with that. Debt ceiling, will be reaching or have reached the debt ceiling. So Congress is going to have to raise that again. Again, that's a very politically fraught discussion. And so that ties into the reconciliation plan and whether the majority party can actually come to an agreed upon direction in which to go. And then I added DEI because, as you know, DEI is a target. And so that's going to play a role in a lot of the direction of the policy going forward. And I added this last piece on Secure Rural Schools and Community Self-Development Act. This was a program that was started 25 years ago. Senator Wyden was a champion of this when it went through. When when changes started happening in how counties and rural communities were getting payments on federal lands from timber and mining and other sources, it really impacted the schools in these rural communities. And so they passed this federal legislation where the federal government came in and backfilled a lot of that. So in Oregon, 30 of our 36 counties count on this dollars for our schools, and in some cases for some of the road upkeep in those counties. That was funded up until December of last year. When they did the continuing resolution through March, that was no longer included in there. And we don't know that it's going to be included. It's not looking like it's going to be included in the new continuing resolution that will get us through the end of the fiscal year. The reason I add that is because I think we all know that our rural communities, if we're going to look at how we deliver healthcare and attract providers to our rural communities, are more than just the hospital and more than just the clinic. So our communities are important to us and our schools are important to us. One, because if we have good schools, we're more likely to attract providers to our communities. But we also know that the workforce we need is broader than just physicians and nurse practitioners and PAs. We need a homegrown workforce. If we don't support our schools, we will not have a homegrown workforce. So I put it in there to help people, to remind people that when we have our discussions and we talk to our legislators and we talk about what's important, our education system is equally important from a healthcare perspective as all of the other pieces we talk about. So how do you engage everybody in your community? And this is the information for the state level. But if it's at the national level, you want to do that, I am happy to help you all. Here is the link that you reach out to get the governor to come to your community. You can reach out to your member of the legislature, Senate or House, and you can reach out to your congressional member and their staff as well. Get them to your facility, get them to hear what you're saying and what you're doing, and help them understand what the impact of what they're doing is on the work that you're doing for your community. So it is a little tougher to do to get them out and about when they're in legislative session, but they are home on the weekends and they do a lot of virtual meetings today. And then the other piece is to prepare and be strategic. So as soon as they're out of session, you're preparing for the next legislative session as well. If you have questions, my email's right here. It's also at the last page of this, and these will be sent out or posted, I'm sorry, on our website. Do not feel, be afraid to reach out to me. I am happy to talk to you about how you can make that work and how you can make those visits happen. And don't forget about National Rural Health Day, a great day to really promote and support what's going on in your community and to bring your member of Congress or your state legislators into the work that you do, into your facility, so that they can see the impact that you're having. Real quick, before I open it for questions and answers, these are some important things that we have coming up: are the forum and the conference and our NBQIP, and our area of unmet healthcare need report is there as well. And I think I've talked a lot. I apologize, but what kind of questions do folks have that I haven't seen yet?
Hey, Bob, there's one in the chat that says, do you know if there are legal challenges to the communications pause?
Thank you. Yeah, there are legal challenges to everything that was done this week right now. In fact, when they put the freeze on a federal judge stayed that until Monday. And so it couldn't go in effect until Monday, but then the administration rescinded it. So, but yes, there are a lot of groups out there that are filing lawsuits depending on what direction they go into. And I should say the biggest problem with the way things have been done, that what we're finding is that there's just no detail, no communication or understanding of exactly what these very vague pronouncements mean. Well, it's 12:28. Anybody wants to jump off mute and ask a question, I'm happy to take it. If you think of anything afterwards, please email me. We are going to try to put together a slightly more regular program like this so we can do more regular updates during the Oregon legislative process and what's going on in DC. So just be some updates and some ideas of what's going on and a chance for you all to ask questions. So stay tuned for that. We'll get you the details out of here in the next week. Thanks, everybody. Really appreciate your time. Have a great rest of your week. Thank you for what you do.